We are proud of our hospital, but it's because of our staff, our community, y'all. So thank you very much for coming out on this rainy night. Well, thank you for the physicians for coming out, taking the time out of your busy schedule. So thank you very much, Dr. Campbell, Dr. Kelley, y'all. Thank you very much. So Leslie, I'll turn it back over to you.
Sure. So the main attraction, I'm not the main attraction.
I have another meeting, so I apologize. I'm not going to stay.
Thank you. I appreciate it. So the reason y'all all are here is Piedmont Heart. So I will turn it over to Dr. Campbell. I don't know if you know Dr. Campbell. Some of you do, I know. Dr. Gibson, Dr. Duello, and like myself, Dr. Kelley's a door ornament. He's been here so long. But please make them feel welcome.
Hello everybody, my name's Chuck Campbell. I'm the newest member of the team. I've been here, I got here the same day that Kevin did, so almost a year ago. My interest is in general cardiology, but also in what we call the failing heart, or hearts that are inefficient. I like to say heart optimization rather than heart failure. And so we have begun a process of figuring out how to best manage people whose hearts are inefficient. And there's enough of us up here that we have a pretty big stable of people to work with. And my partners and I have thrown ourselves together to try and do this better. The first thing that we've done is with the help of the hospital itself is we've started something called a heart failure clinic. And it started off as a one-time-a-month thing, but I think we're going to rapidly expand it to once a week, where people who just need to be seen pretty frequently to get intravenous medications for their heart can be seen and interact with our staff and interact with our team and try to keep people out of the hospital. This is, come in for frequent outpatient visits rather than be kept overnight in the hospital more often. Additionally, I work very closely with the advanced heart failure team in Atlanta. People now are getting all kinds of new technology thrown into the mix to try and help them feel as good as possible for as long as possible. That includes heart transplants. It includes left ventricular assist devices. It includes all kinds of very complex procedures on their heart valves. Additionally, there's some surgical procedures that can make people feel better. And I think Piedmont Heart has the best team in the Southeast for doing this. And if you're the best in the Southeast, that means you're probably the best in the country, since everybody's looking up to us. So we think we're as good as it gets. And it's been a real honor to be a part of this. I came here again a year ago, and I was welcomed by my partners, Dr. Duello and Dr. Gibson. Every now and then we see this guy, Dr. Kelley, coming through when he's not doing the real important work in Atlanta, and it's been a real honor to be a part of this team. Dr. Duello.
I think what's really neat about our group is we all individually bring something separately to both the Piedmont organization and the hospital. So I'm Dr. Duello, Katherine Duello. I have been here now over 3 years, which time has flown. I grew up in Augusta and moved here after finishing my residency and fellowship at Mayo Clinic in Jacksonville. And Dr. Kelley talked me into coming up here, and it was the best decision that I ever made, and I made for my family. We have 2 children. My husband's a local attorney here in town, so we are here. We are not going anywhere. We're invested in the community, and we love it up here. So what I feel like I bring to our group is my specialty within cardiology is cardiac imaging. So while all of us, we do echocardiograms, which are ultrasounds of the heart, we do nuclear stress tests both here and at the office to check out the circulation of the heart, but also something that we've started within the last 5 years and we've really developed since I've gotten here is our cardiac CT program, which I'm sure some of y'all are familiar with the procedure of catheterization where they put in stents and they have to actually go into your heart and put catheters in there and squirt dye. Well, we now can do a similar procedure to that with a CT scan locally here at our hospital. And we are probably one of the few rural hospitals, definitely in Georgia, and probably one of the few in the country that do as many as we do up here. And so we and diagnose them up here with or without disease and help decide that. So that's something that we've brought to the community that I'm really excited with. I think we've almost are doing 10 times as many as when I started here every year. So that's really exciting. We're also expanding it, doing some cases, preoperative evaluations, so you don't have to go back and forth to Atlanta quite as much. So that's something that I bring up here. I love the community. I love Piedmont Heart. Like I said, I trained at Mayo Clinic, so I feel like I'm used to a big hospital system that is very efficient and excellent, and I don't feel like I provide any different care to my patients up here than I did when I was working with them. So I feel like for a rural community, we do such a great job, and part of it is this team we have here, part of it is the hospital that works so well with us, and then part of it is our colleagues down in Atlanta. One of the beautiful things is anytime I have a question, we pick up the cell phone. We talk to the folks down in Atlanta. They call me when they do a surgery. They say the surgery went great. And I think that communication with all of our peers is something that helps us provide great care up here. So I think that's it for me. I'll introduce.
I want to brag on Katherine. I got to talk to the person that runs our imaging center, the big boss of Piedmont Imaging, who runs our Center of Excellence. And he tells me that the studies, the CT studies that are done here in this hospital are as good as any in the system, and that Katherine does a really amazing job of reading them, and that just makes it all. I mean, right here in town, you can get a really first-rate, world-class CT scan done, so that's great.
And Piedmont, just to brag on our imaging, so for cardiac CT, cardiac MRI, we do the most in the state, and probably the most in the southeast. So we're a high-volume, high-quality center, so we're really doing a lot, and the fact that we can do that up here is just fantastic for us. Well, I will introduce Dr. Gibson to tell you what he brings.
Awfully short applause. So for better applause, let's say thank you to Jesse and Alicia and the rest of the folks from the cafeteria. They've done a wonderful job. I always look forward to the Dine with the Doctor times because it's probably the best meal that I have each month. I cook for myself, and trust me, this is a lot better than I would be doing at home. So, well, again, I'm Mark Gibson. I am, I guess, the second oldest person here with Piedmont. I've been here for about 4 years now. Before I came here, I was doing invasive, all kinds of fun stuff in cardiology. Came here and just changed to general cardiology with also doing pacemaker implantations and that sort of thing. So I'm your electrician if you have any electrical issues, and comic relief if you don't. I really can't add a whole lot to what Drs. Campbell and Duello said. I love the hospital, love the town, love living here. And one of the cool things is, to me, and some of you may have heard the story before, but when I was a kid, there wasn't a whole lot you could do with hearts because there wasn't much to be done. And if you did have something done, you had to go to the big city. And I grew up in a little town that makes Blairsville look big. We had 2 stoplights. We were proud of both of them. We also had a flashing light. I used to say we had 2 stoplights and a flasher, but when I went to the big city, I found out that flasher has got a different connotation. So I try not to say flasher. I always say flashing light. Probably best, but when I was 8 years old, my grandmother Gibson died with a heart attack. She went to the hospital and never came out. And it was a very sad time for me, and it was also kind of sad because, when she left the house that day, she went off to the city and I never got to see her again. And I've always thought, why is it that people have to go somewhere else for good quality care? Why can't the good care come to them? And it's just the neatest thing here in Blairsville because we've got a terrific hospital, a lot of support. Piedmont gives great support from Atlanta, and I've got 3 partners that just blow me out of the water every day. They're just wonderful. And I love the patients, I love the town, and like I said, why should you have to go somewhere else? You know, if home is where your heart is, shouldn't your cardiologist be there too?
Okay, well, I am excited about this crowd, I tell you. This is a great turnout on a bad evening in terms of the weather. But if any of you grew up on a farm like I did, you learn not to worry about the weather because you have absolutely no control over it, right? One thing that I've had control over is the fact that I chose to finish my career where I grew up. I grew up just a few miles down the road, and I grew up on a farm, and never in my wildest dreams did I ever entertain the possibility that one day I would be a cardiologist taking care of friends and family and acquaintances, many of whom I grew up with, many of whom are parents of my fellow students, and it's an honor and a privilege to be back here. I've been back since 2006, having practiced in Augusta for over 30 years. So, what is unique about this area? What is unique about this hospital? And what is unique about the services that are provided here? Well, number one, it's a hotbed for heart disease. Okay? So, it's important to have services available that not only diagnose, but can assist in management and treatment and long-term therapy for heart disease. Okay. We've come a long way, and we've got a long way to go. But if we look back in the mid-2000s, here's the way it was. There was only, in 2006, one full-time cardiologist here, and you're looking at it. We had part-time cardiologists that would come and go, spend a day, and then go back to Atlanta or back to Gainesville. But we didn't have anybody full-time. So we changed that. We had a cardiac rehab program that had been terminated because it could not be supported by cardiology from 2 hours away. We did not have cardiac CT scanning, so we did not have a non-invasive way of establishing whether or not somebody was at risk for a future heart attack. We did not have pacemaker implantation available here. And if you got sick with a heart problem and it was the wrong day of the week, you had to wait in the hospital 2 or 3 days before the cardiologist arrived from out of town to see you. So fast forward to now, there are 2 major groups of cardiologists here, ourselves in Northeast Georgia. We're all friendly competitors. We all work together and help each other. You've got full-time coverage 24/7, 7 days a week. The only thing we don't do here is interventional work and diagnostic work in the cath lab. We have the expertise to do that. We've all done it. But we don't have the necessary resources that require a larger institution to do so. All right? But you can be stabilized here. We have a chest pain center that's certified by the American College of Cardiology. We have a cardiac rehab program that is absolutely ballooning. And if y'all can stand up in the back, these are 4 representatives. Rehab program. I think we see, Laurie, about in a month's time have about 600 encounters throughput per month. Isn't that about right? Yeah, so that's every month. Okay. So we've been truly blessed, and as my partners have said, we are a true team. When you see someone in our group, you have access to everybody, and each of us has expertise that we favor as our sort of bread and butter, and each of us has exposure to a broad range of capabilities. The good thing is you have automatic access to an in-house second opinion without having to go through the process of a formal consultation elsewhere. And so we bounce cases off each other all the time. But what do you think about this? This is what I'm thinking about doing. What do you think? So you have that ability to get more than one opinion. But we're not here to toot our horn. We're here to listen to you a little bit. So we're going to open up some burning questions. We're not here to make diagnoses today, although I've already made it 2 or 3 as I walked through.
That was just on me.
But we do have right now 90-some% through the process of being formally certified for advanced heart failure. So that's another feather in the Union General Hospital's cap. We could not do all this without the support of the hospital and the hospital board and the other physicians in the community. Not many communities this size have the opportunity and the options for primary care like you do here. There's numerous very good primary care physicians here that are still taking patients. That's not like that in all communities. Okay? So we're very fortunate. And this hospital is not just a hospital for Blairsville or Union County. This is a regional hospital that's becoming a regional center for referral in a 5-county area. So this hospital, 35% of our patients that we see next door at our office are from North Carolina. Okay. So we see patients from Fannin County, from Gilmer County, from over in Clayton, from Franklin, Murphy, Hiwassee, all over the place. So thank you for coming. All right. So Dr. Campbell is wide open for questions. All right.
I know before if there was a heart attack or a really heart problem, that we would fly them to Gainesville. Okay, do we still need to do that with all of you here, or?
If it's a heart attack, you need to get to where the artery can be evaluated and opened up if necessary. So we would stabilize properly, make the diagnosis, and then get you transferred right away. And you've got 2 options, either Gainesville or Atlanta. And there's not 10 minutes difference in time.
If you have to have a stent put in, is that done here, or do you have to go someplace else?
No, you have to have a cath lab in order to diagnose the problem and put a stent in, so it could not be done here.
So to Gainesville.
Well, you could go to Gainesville or to Atlanta.
You talked about you needed resources here. How can the public help you get the resources that you need here? So we're not flying out to Gainesville or Atlanta.
Well, number one, you gotta realize the capabilities.
Okay.
We're not gonna put a cath lab here tomorrow. To have a cath lab and to do stents and to do major cardiac work, you've got to have 1,000 cases a year. We're not gonna have 1,000 cases a year here, okay?
Yes.
So you got to be appropriate. So our work is gonna be diagnosis, management, stabilization, transfer when appropriate. 90% of the stuff can be done right here, but they'll never 100% of everything be done here, and shouldn't be, because the volume would not be sufficient to maintain expertise. All right, I'm gonna move over here and let somebody else take center stage.
Yes, sir.
Did I understand her right to say you can do a CAT scan now or a CT instead of a hard CAT?
Yes. So part of the reason that we feel very comfortable with the things and I'm not as worried about not having a cath lab here is that increasingly Dr. Duello can evaluate and the Union General team can evaluate someone's coronary arteries with a CT scan.
Okay,
And-
that's good.
And it's impressive. It's very impressive. And then if you go down to have a stent, then they know what they're looking at. I would tell you, to answer your question, you want your cath lab to be run by people that do a lot of procedures. And you want your cath lab to have some people in it that are world-class. There are probably too many cath labs in the United States, just without talking out of school. There aren't enough great cath labs. We know where one great cath lab is, and that's Piedmont, Atlanta. And so if you have to have something done that's very complex, they know what they're doing. The people that run that cath lab are often on planes going out to other places to teach them how to do it. People fly in from all over the world to get their cases done there. That's like Mayo Clinic, that's like Cleveland Clinic. So I think that's really important. What we want to do is only send people down there that need it. And that's what Catherine's offered us with her expertise.
A quick statistic that I think the hospital should be very proud of is if you are having the big one and you walk into our ER and we identify it quickly, they identify it within 5 minutes. That's standard of care here. They get you on a helicopter, which is here 24/7, barring any snowstorms, fog, or anything. You will be in the cath lab in Atlanta in the exact same amount of time and getting that artery open as if you walked into the door of the ER at Piedmont in Atlanta. It takes 30 minutes to activate a cath lab to get everybody together. It takes 20 minutes for us to get you down there. So the care you get down there is phenomenal. So I don't think that should be the fear, is that we can't take care of something up here. If we get you to the hospital, you will be in the cath lab and get that open in the same amount of time as somebody in Atlanta, in a big city. And that's thanks to our helicopter and our systems here, so it's very good. Yes?
So you can request if you needed that emergency flight to go to Piedmont.
You can request to go to Piedmont, yes. Now, there's always can be some limitations due to crowding situations, things like that.
Weather?
Well, weather for flight, I mean, barring the snowstorm last week when we couldn't drive people out either, when that wasn't safe, but that's a pretty rarity. But we can always get down by, cause I think it's fairly rare you actually need the helicopter to get down there. Most of the time we can stabilize you enough to get you in an ambulance and get you down, so, yes.
After a stress test, what kind of pictures do you take of the heart? I'm guessing.
So the way a stress test works is, if you've ever had a stress test, we take 2 sets of pictures. The first set of pictures, and we give you a little bit of dye, IV dye each time. That dye hooks on to the red blood cells. The red blood cells then go to your heart, and we're taking a picture of your heart before and after. So what we're doing is seeing where that IV dye is going in your heart to see where the blood is going. So if there's any area of the heart not getting blood, either at rest or with stress, then that can signify that there may be a blockage. So that's pretty much what we're getting when we do a nuclear stress test.
Is what you're talking about, do you use iodine for that?
No, it's actually a radionucleotide. It's a nuclear type of dye. It's not iodine. Now for the CT scans we were talking about earlier, that is an iodine-based dye. So, but a good question. Yeah.
Thank you.
Anyone else?
I was just gonna say, when you were talking about time frame, when I had my heart attack, they flew me down to Gainesville, and they had my stent in, and I was out of surgery before my family could even get to Gainesville.
Yeah.
That's amazing.
Yeah.
It's really a great system. So.
The Hiawassee, what if you're in that hospital and all that's going on, do
They're
you
going
all
to-
move there, or they
They'll-
move to you?
They'll move you here if you need us, but if you need to fly out of there, they'll get you flown directly. You don't have to come here before you fly.
Yes, I think it's pertinent to note, if you enter Chautauqua Regional Hospital and it's a heart attack, 9 times out of 10, they're gonna send that EKG confirmation to one of us. We look at it, we talk with the ER physician, develop a game plan of management, and then it takes place. So you wouldn't be necessarily having to come here and then go somewhere. You'd be leaving from there and either going to Gainesville or to Piedmont.
You guys would be consulting together to
Yeah, yeah.
put it together.
And sometimes they don't need anything. I mean, it's obvious and they already have a game plan. You know, that ER is not chest pain certified like this one is. Our goal is to get that done.
I have a question.
Yes.
Does a lot of this depend on what type of insurance you have as well?
You're gonna get treated the same way regardless whether
But
you
I
got
wasn't
a
offered,
penny.
I had a stroke 5 months ago, okay, and I was life flighted, and they gave me a choice of 2 hospitals, and neither one of them were the 2 y'all are talking about.
Yeah, well,
That's why I just wondered,
you,
but I was completely
you had a
happy.
stroke.
Yes, I did.
Everybody's been talking about heart attacks.
Yeah.
Now, a stroke conference and topic and conversations is
Different.
it's a vascular problem, but
Right.
it's a different issue.
Oh, okay.
And they all,
Honestly, with stroke, you're probably more likely to go toward Erlanger than you would.
That's where we,
Right.
well,
That's where it
Or
should be.
Kennestone. Right.
yeah,
So there are actually stroke centers like there are heart centers.
there's in Kennesaw or Erlanger.
right.
Yes, sir.
But I will tell you, we've sent strokes to Piedmont, Atlanta, and they have all the same capability, but they have not touted or marketed their stroke program
Oh, is that what?
like Erlanger has.
Yeah.
And Erlanger's got a great program, but Piedmont and Northeast Georgia as well is getting ready to launch a major marketing program for their stroke program. And so they'll have a certified algorithm plan, just like Erlanger does, and just like all the other stroke centers do.
Yeah.
It's already in the works.
Yeah, I've been to Piedmont before, and food's great there too.
That's it, anyone has the right, or your family, and it's probably a good conversation to have with your family members to where you would want to go up here if you have a crisis, because that is something that you can request. There's no, insurance doesn't have to do with it. The only thing that ER doctor is doing is trying to get you taken care of to the best of their capability as quickly as possible. But if your family member says they're a Piedmont patient, they really want to go there, they'll pick up the phone and call Piedmont. So you have more, I think, more sway in it than you know. But that's probably a good conversation. Sometimes it's an emergency, we don't get to have that conversation. But if you communicate with your family and they do tell the ER physician that, I think that will be, your requests will try to be accommodated. So.
I can verify that from experience. My son had a stroke. And it was, we'll take you to Erlanger. No, give me Erlanger, we've been there before. And I said, no, I want you to take me to Emory. Because Emory had a book about this thick, the many years he had been there with end-stage renal disease.
Yeah.
And another thing I know that has happened, there's been a couple guys in our church that walk into the emergency room, walk out and get on the helicopter, basically just in minutes, a few minutes. And then, it's about a 20-minute trip, either to Piedmont or to Gibson.
Did you have a question?
Can you explain how sleep apnea affects your heart, how all of that?
Sure, I'll do the best of my capability. So basically, when you sleep, it's a very important function of humankind, sleep. And what can happen with sleep apnea is as we age, I think, our skin changes and our insides change as well. So the structure of your throat that may have been nice and sturdy when you were younger can collapse when you sleep. So if you lay back and that your throat or their airway collapses, you may not be getting good air all night long. You can sleep and think that you're getting good sleep, but your brain is on high alert all night because it's saying, I'm not getting enough oxygen, I'm not getting enough oxygen. And that puts your whole body under stress. Your heart, just one of the organs that's affected. So we see the kind of more common side effects of that, besides being really tired because you're not getting good restful sleep, is it puts stress on your heart, and rhythm issues are very common. So if you have atrial fibrillation, which is a very common rhythm disturbance and is actually scary to us and should be to y'all because it's associated with strokes, is very common in people with sleep apnea. So it can happen, we tend to think of it as heavier men tend to have it, but it can happen in anyone. And And that's just because as you age, the structures in your body change. The way it is treated is, once it's diagnosed appropriately, is you wear a mask. And what that mask does is it puts pressure on your throat to keep your airway open all night, to make sure you're breathing in and getting enough oxygen and not causing that stress on your body and your brain to not have oxygen, and it helps you get that restful sleep. That's kind of in a nutshell how it affects. So
Now, if you don't, I recently got the machine, and Medicare watches you quite
Yes.
closely for, I think, 13 months. But it is annoying. I almost very look forward to going to bed now. But if you don't use it like every night, let's say I wanna take a vacation from it for a couple of nights. I mean, is it something you need to use like consistently?
the more the better. So, and also for Medicare, they're gonna want the more the better too.
Yeah, well, I know that.
Try-
I've got 13 months.
Try another mask.
Well, I have the little one for the
Keep
nose.
trying different things. I wouldn't even think about taking a nap without my CPAP. I almost put it on to drive to work in the morning. It's that good. Katie, my nurse, won't let me wear it in the office. She says it just doesn't match any of my, so yeah. It takes a little.
Is that why you were wearing it when you were coming to my office to talk?
That's right. So
I
yeah,
hate when I put my partners to sleep too.
Yeah.
So embarrassing.
So it's actually then, I mean, I can't really understand the concept of the air, but you say that air opens your
It's the
throat.
pressure.
oh, it's pressure. It's not the air, it's the pressure. Keep your throat open and let the air in and out easily.
So it's not collapsing. It just causes the pressure to stay up. And I've had so many patients, I'm sure all of y'all and some in this room, who have said it's life-changing. Who said, I didn't know how bad I felt until it got treated. And I'd say give it a few months. So, and work with your provider, whoever's, they have different masks and
Yeah,
different
yeah.
fits. And, you know, it can be a painful process, but once, the people who do so well on it, it's just amazing. People walk in and they're a different person, so.
And don't give up. There are other things. You know, that they have a whole list of things that they can do to try and help you with it that are over and above the mask. So, yeah, just keep
Such
talking to them.
as, such as.
Other surgical procedures, there's bite blocks and things like that.
And just to our own horn, so we do have, so I think that, underutilized are sleep specialists, so just like you have cardiology specialists, there are pulmonologists who do an extra year of sleep medicine. If you're having a hard time getting it treated, seeing a sleep specialist can be very beneficial. We actually have one within Piedmont who goes to Jasper. She's an hour away, Dr. Raju, she's fantastic, so talking with your provider or one of us, we can try to help you get set up with her. So
I have
would-
trouble just sleeping, period.
Right, and she's a sleep physician, so not just sleep apnea physician. So she treats all forms of sleep
And
disorders.
where would she be?
In Jasper.
Let's not dwell too much just on sleep apnea
Yeah.
tonight.
Yeah, I was just.
Let's try to focus on.
Yes, ma'am.
They used to say if you think you're having a heart attack or your spouse is having, lay them flat. Then the last thing I read is have them sit up. Which is best?
Call 911.
But until they come.
Have them sit still, get 911. The biggest thing that I see in the region, the scariest thing are people who are in denial and don't come in. And there's a lot of reasons. You know, we have patients that don't come in because their spouse is also sick and they don't want to leave them alone. You have to come in. The second thing is you don't want to drive yourself. Part of the upside of the county you live in is that you have excellent emergency medical services. They'll get an EKG on you before you get in to the hospital sometimes. They'll have the plan figured out before you even get to the hospital. And that saves you 10 minutes or 15 minutes, and that can change the whole thing. So you don't have to overthink it. If you've got some baby aspirin, choose some baby aspirin, get on the horn, get in and let the team figure out what's wrong with you.
And might add, there's some excellent first responders
Yep.
that work with our 911 system, and you might not even know they live down the street from you, like I did. And they were there and
Right.
took charge before the ambulance actually got there.
The most experienced healthcare providers in the area, outside of Dr. Kelley, are likely your EMS group. Those guys have been doing it a long time. They do it every day. They're really good. When we sit in our meetings, they're focused on process improvement every day. John and the ER team have got AEDs around. John and the ER team have trained the first responders on the phone to help people through CPR if they don't know what to do. So you're really pretty well served by this group. So just take advantage of them. Don't drive yourself. Yes, ma'am.
Could you just reinforce the difference of women's heart attacks and men's? I know that we have a tendency to have different symptoms. Am I correct?
So the problem we have is when traditionally when all the studies were being done in the 60s on heart attacks, when it was just a boom in information and learning about, they were not allowed to do studies on women because women had babies. So that has since been changed, and they've expanded that. So a lot of,
Can I have babies?
so that's been changed. So probably in the last 20 years, we've really started to realize and do more studies on women's heart. It can be challenging because women don't always present, and not all men for that matter, present with the typical elephant on your chest that you see in the movies. Some women I've had women say they have jaw pain, tooth pain, just shortness of breath. I've had similar things with men. What I tell my women, because it can be difficult, just like Dr. Campbell was saying, is don't ignore new symptoms. So if you have something new, I say in my women, anything from here to here that's new is worthwhile discussing with your provider, either your doctor. If it is new and not going away and severe, get to the emergency department and get it checked out. I also tell my women, use your women's intuition. If something doesn't feel right, if something feels new or different, get it checked out. That's what I tell. So.
Who was that?
Yeah, there isn't going to be one thing that distinguishes the heart attack that a female has versus a male. If your suspicion is that you're not doing well, this is not the time to get in the car and drive yourself 45 minutes to the hospital. Again, the EMS team can get there usually within 10 minutes, and they can do an EKG within 5 more minutes, and they can tell you whether you're having an emergency or whether it's something urgent, and you can go on in. It's just, again, heart attacks were defined by studying 65-year-old men in 1965, and so you have one set of symptoms. That's just the way the studies were done. It doesn't mean, even men have very strange symptoms sometimes.
That said, we're a chest pain center. We are experts at helping decide, and we're not good at it either. If you come here, nobody's going to say, oh, don't worry about your chest pain, just go home. We're going to check it out because we can't tell either sometimes, but we have a protocol that we go through to make sure that we're not missing anything and to make sure it's safe. And I always tell my patients, I would rather rule out 1,000 heart attacks than miss one. So just.
And our rule out protocols are 99% effective. I mean, there's always, you'll always hear about somebody who says, well, I had a heart attack, and every now and then someone's having a heart attack and these systems don't work, but 99% of the time, 99.8% of the time in some states, we can tell if you're having a heart attack just by being patient. Just give us the time.
And in reality, what's the worst thing that happens if you come in and find out your heart's okay? Stuck with this earth for another 30 years. So you come in and get good news. That's something to be celebrated, not to feel bad about. And if you come in and it's something that we find that could have been a big problem and fixed it, then celebrate that too. There's no bad answer except staying at home and having a heart attack or a bad outcome that we could have prevented. And we're very nice people.
He recently got this device that goes on his phone, and a lot of people don't know about it, where he can check his EKG. He puts his fingers on there.
Right. So
What's that called?
There are
Cardia?
Yeah, right. So there are several new devices that can turn your phone into an EKG machine. And they're out there. You can just say, turn my phone into an EKG machine. An Apple Watch will do it. I guess I'm not ready to endorse one or the other yet because we're still very new. The New England Journal of Medicine in February had a study, or January they had a study on the first use of Apple Watch to find atrial fibrillation. It was intriguing, but it's the first study. So I would say keep your eyes tuned. I do have some patients
Your
that.
iTunes?
All day, this is what all day is about.
So they're not necessarily accurate? Is
No,
that
they're
what-
accurate, I just don't know whether they change outcomes. They're fine, if you have one and you're worried about it, take an EKG and work with us and you can bring it in. But I'm not suggesting, I'm not ready to say everyone ought to have one yet.
Oh,
But that kind of stuff is out there.
Don't go out and buy $1,000 phone just on the off possibility that you might want to have an EKG on something.
Right.
it wasn't that much.
No, the device itself is $100 on
Yeah,
top of your phone.
it's 100.
And you can learn a lot. If you're worried about palpitations, my wife has one, she has palpitations, every palpitation is my fault. Every single one of them is my fault, and I'm a cardiologist, why can't I fix this? And so it's been wonderful for my marriage.
Yes, dear.
Are you all on call at the emergency rooms then? If-
Yes, ma'am.
One of us is on call all the time. During the week, we're all around. On the weekend, we split it up.
Are y'all leaving your business cards up here?
We can.
That's a good idea.
Yep. Oh, yeah. I think I have one. I do.
Well,
Indeed.
I think it's been great. I think you've had great questions. And hopefully,
We won't need to come see you.
hopefully not. I'm sort of like the plumber, you don't want to see the plumber too often. You definitely don't want to see your cardiologist too often. But it's nice to have access. It's nice to be in a community where we have the ability to talk with one another and visit with one another, not just from a medical standpoint, but, everybody lives